This is a series of videos taken from my course, Effective Treatments for Sciatica. Being effective for sciatic treatment as well as lower back pain, what I found is that the ligaments, which don't get very good blood supply, which don't stretch, and they're super strong, ends up causing most of the dysfunction. It focuses on the lateral rotator tendons, the sacral ligaments, and the sacroiliac fascia. I hope you'll try it. The lateral rotator tendons and the lateral rotator muscles. This is previously thought to be a very important area to treat. I might spend more time on cross-fibering the tendons and almost no time working on the lateral rotator muscles. If it's possible for the person to go into external rotation of the hip and hip flexion with bending of the knee, this will cause a little bit of tension on that sensitive area. From the greater trochanter, go just medial to that, the widest part of the hip, and those are the lateral rotator tendons. They can be very sensitive. Being careful about using your fingers and thumbs, because I have a tendency to wear those out too much, so this is a good spot for the elbow. But remember, be careful, this can be really sensitive. This is where most of the problem is. It's the attachment point, the tendons. They don't get a lot of blood supply, they don't heal well. The second part is going from gluteus medius and angling yourself down to the ischium bone. You're literally going against the grain out of all of the lateral rotator muscles, smoothing out any speed bumps, going really super slow. So that whole process is about 2 minutes. As you can see in this image, most all the lateral rotator muscles, they look like a fan coming off from the posterior greater trochanter. So you're going totally against the grain, and the whole area should release in approximately 2 minutes. With the lateral rotators, they look like a fan and they all attach to the posterior greater trochanter. You don't have to put them in this position, but if you can, this will tighten this area up a little bit. So by bringing their knee off the edge of the table and then dropping their foot, if the foot doesn't want to stay in place, just put them into a little bit more hip flexion. Then we're going to concentrate on the area just posterior to the greater trochanter, which is right about there. So just by using a supported thumb position or tools and just any number of different directions you could go. Actually, it's a little easier for Mr. Elbow. But remember, you're using your body weight, so you might have to lighten up on your pressure a little. Is pressure okay?
It's tender. It's better.
So there's no special direction that you have to go in. It could be in any direction. You might have to just hold that spot for a second. It might refer. This might be an issue that you need to concentrate on for a while. Right about there? Good spot.
It's all tender.
That's a bad spot. So that spot kind of goes southeast. Everything attaches into this spot. It's a common lateral rotator tendons. Next is to go against the grain out of all these muscles. You could either go up or down. I usually prefer to go down. So I'm going to start about gluteus medius, and I'm going to go down to the center of the glute, and then I'm going to go over top of gluteus maximus, and then I'm going to end up at the ischium bone. So with here, going in very gently with Mr. Elbow leaning into it, going straight down. So I'm going to start this way. Since we're working on clothing today, because this is normally done on skin, so you want to make sure you drape them appropriately, So working on clothing, you might have to cup your hand around your elbow, and that'll help you to slide over clothing better. So we just allow this to let go, shouldn't take too long. About in the center of the glute, the sciatic nerve is very superficial, is very exposed, so you might have to lighten up a little bit more.
Do you use a queen?
Just a touch, yeah, not much. Yeah, just to limit friction, but not much. After we get past that, the next spot we're going to come to is down here, which is going to be the lower portion of gluteus maximus, and it's a major speed bump. So we don't want to bounce over a speed bump. We want to try and bear down and go through it. I've also started to change my pressure a little. I started like this, and now I'm going to be coming in like this, and eventually I'm going to be coming in like that, because I don't want to just fall right off of it. So gluteus maximus, the lower portion is down here. So when you get to that, notice I'm not speeding up, I'm taking it nice and slow. This is a really sensitive area. But if you treat this well enough, you don't have to go back and do it again. One time is enough. Because we spent so much time on hamstrings. We're almost there. Now I'm changing my direction even more to go this way. Is pressure okay?
Yeah.
We're almost there. Oh, there we are. Lower portion of gluteus maximus, try and go through it instead of bouncing off of it. Then we're going to come to a nice flat spot, and then the ischial tuberosity. That's where we end up at. Okay, good. The sacral ligaments. In some cases, dysfunction of the sacral ligaments could refer pain into the sacroiliac joint or also down into the sciatic nerve. If this area is hypersensitive, continue working on this until there's no sensitivity. This area could be sensitive because of falls as a child, epidural injections, or slouching too much. The sacral ligaments, we're just working on one side here, the left side, just working off of the midline. It's not very wide, maybe an inch or two in width. Just keep going deeper. Uncomfortable but never painful. As it starts to soften, you can go deeper. So where I find this region is just off of the center, and my fingers will go down to the coccyx where my finger falls off. The top of the sacrum is just below the posterior superior iliac spine, and you only go out maybe an inch or two just medial to the posterior superior iliac spine. Now remember, you have 3 layers to get through, so it's one layer at a time, and I'll cross fiber that for a few seconds and I ask the person, is it sensitive? If it is, then I back off a little bit. If it's not an issue, then I just keep going and work with the person, uncomfortable but not painful. Next is the ligaments that go over top of the sacrum. So we're working the right side of the body, and then you can also see the seam on their pants too. So I want to be just off of the right side of that seam. I want to be off of the midline. At no point do I go anywhere near the posterior superior iliac spine. It is way too sensitive. So I walk down, I find the tip of the coccyx where my finger falls off. Then the posterior superior iliac spine is here, so I need to be in between these points. And I'm just off of the midline on the right side. So from here, by using your fingertips, try and support your fingers if you can. Then I'm going to go straight down into the body when there's kind of a response. As far as the tissue, then I'm not going to push down anymore. And I'm just going to sink into it, and then I'm just going to cross fiber, very small little move east and west. So if you don't have the fingers for this, then just use your knuckles. That works pretty good too. So just on this right side. So as I start, I'm using probably about 3 to 4 pounds of pressure. Is that pressure okay?
Yeah.
Some people, this is a real dysfunctional sensitive area, so this could require you 10, 15 minutes to stay here. So you might really wear out your fingers at that point, because this could actually refer into the sciatic nerve. This could be the cause of it. So I'm just cross-fibering back and forth. As this releases, I'm going to use a little bit more pressure, and I'm going to keep going down. But remember, you want to be patient, not rude. You want to slowly get into that area. Is pressure okay?
Yes.
The problem is, the more pressure I'm starting to use, if you look at my body, you can see my shoulders are starting to creep up to my ears. This tells you that you need better leverage. So now I can get up on my toes, and it's better, but it's still not there. So this tells me I need to get up on the table. Now take a look at where my shoulders are. See the difference? So let your shoulders tell you if you need better leverage. If your shoulders go up to your ears, then you need to get higher. So with this, I'm directly over top of my fingers, and there's like almost no strain on my body whatsoever now. And if I need more pressure, I just lean into with my body more. This is so much easier on me than doing it the other way. And the best way, of course, is to have a hydraulic high-low table. And then I don't have to get up this high. Pressure okay?
Yeah.
Is there any way you could describe to people what this feels like?
Very firm. It feels like knuckles. Is that what you're using? The fingers.
Fingers. Is it relaxing or is it uncomfortable?
It's uncomfortable, but not painful. Just
Okay, good.
very firm.
Every time that this releases a little bit, then I use a little bit more pressure. So I started with about 3 or 4 pounds. I'm up to about 10 pounds now. You can kind of see if you can see my fingertips, they're kind of turning white. So I'm using a lot more weight on here. Did you feel anything? Did you feel that release just now?
No.
No. So you're just off of the midline. At no point do you ever go anywhere near the posterior sacroiliac spine. It's way too sensitive. So after doing this for a good 60 seconds to 2 minutes with really good pressure, then you want to ask them, how sensitive was this? If it wasn't sensitive, then just go on. If it was sensitive and if it's uncomfortable, then there's a problem here. You need to continue. So how long do you continue until there's no more issue? So with her comment was that it was uncomfortable. So that means that you definitely needed to stay there a little longer on her and just keep doing that. And as I say, if you don't have the fingers for this, then use your knuckles or a tool or something. The iliolumbar ligament. This nasty ligament has to be one of the most painful sensitive ligaments we have in our body. It attaches from the transverse process of L5 to the iliac crest. If you remember what Dr. Ben Benjamin said about a structure that goes more laterally, that's main support for everything above it. So in a sense, this is literally what happens. It's one of the main supports for the spine. It's dysfunctional and sensitive on just about everybody because this ligament is under constant tension and strain. Remember, ligaments don't get very good blood supply. And we might move our lumbar vertebra, but very rarely do we ever move our L5 vertebra and S1 independently. They usually move together. So this ligament's very sensitive. It's also challenging to access. Just to get to this ligament, it's 1 inch down into the body. It's just medial to the posterior superior iliac spine. Because of the sensitivity of this ligament, it might require multiple appointments just to be able to reach it. I hope this animation will help you to appreciate the depth of this sensitive ligament. Next is the iliolumbar ligament. The iliolumbar ligament attaches at the transverse process of L5, and it's 1 inch down into the body just to get to it. So what I'm going to do with supported thumb position is go straight down, and by using her feedback, when she tells me that's enough, then I'm going to cross fiber north and south. And it's easy to find. You find the posterior sacroiliac spine, go touch medial, and touch superior. It's right there. So in order to do this correctly, though, you need to really get good leverage to protect your body. So if this is the posterior sacroiliac spine right here, then I'm going to go a touch medial, about 1 inch, and a touch superior, so about 1 inch that way. So it's an L. There, there. It's kind of a flat spot in the low back, so you're well above the hips. So in order to do this correctly, I need to have good leverage to protect myself. So I'm up on the table, supported thumb position, and I'm going to go straight down. So PSIS, go a little touch medial, a little touch superior, supported thumb position, and I'm working with them. So you need good feedback. When they tell you that's enough, then that's when you cross fiber it north and south for 5 seconds. Ready? So you tell me when that's enough. Just go straight down. Then you cross fiber north and south. 5 seconds. So I'm just using my body weight to do the work, because there literally will be some people that won't say anything, and you have to keep going down to the basement to get there, because it's 1 inch down into the body. So we got maybe ½ inch on her. So we didn't even get down all the way to that ligament. Wasn't that uncomfortable?
Yes.
So there's no point in overdoing it. If you want to go back, you can do it again, but this will actually help her a lot, even though we just got in a ½ inch and cross-fibering it for 5 seconds. People comment to me, Gary, they feel like that's the epicenter of my problem, because all the pressure is right there in that ligament. The sacroiliac fascia. The positioning of this will be the exact same as it was when you were cross-fiber frictioning the sacral ligaments. But instead of cross-fiber frictioning, you're just going straight down through the different layers of fascia. There are approximately 10 layers to get through. Minimum of 2 to 5 to 10 minutes for this. I prefer to use my fingers because it's very specific pressure. If you don't have the finger strength for this, you could use the heel of your hand, your knuckles, your forearm, and you go straight down to the tissue barrier and then just wait. It could be uncomfortable but never painful. As it starts to soften, go deeper into that area. You can go same side of the body, cross the body, but just keep going straight down into the center of the pelvis. People comment to me, it feels like my leg is getting longer. Positioning on the same side that you were treating before, off the midline and medial to the posterior sacroiliac spine. So I'm primarily going straight down, maybe just angling a little bit towards the outside of the hip. So it's 99% going straight down and maybe 1% going laterally. That'll help you to decompress the sacroiliac joint as well. And you focus on going straight down. I chose to show you this image of the latissimus dorsi with its attaching tendon as it goes into the spine as well as the sacral area. If you were to look at the sacral ligaments that we've already treated at its deepest layer, on top of that is the tendon of the attaching latissimus dorsi. On top of that is the thoracolumbar fascia. All three of these areas at the posterior sacral area, as it goes into the back, are all very similar tissue. They have a tensile strength of over 2,000 pounds per square inch. They don't stretch. They have a little bit of give to them. They don't have very much nerve innervation, and they don't get very good blood supply. So when they get injured, a lot of times they stay injured. So we have a dysfunctional sandwich of ligaments, tendons, and fascia. So this is one area of the body with all this different layers of dysfunctional tissue that requires a lot of attention. This is the sacral fascia, the fascia that covers the sacrum. So if this is the tip of the coccyx and here's the PSIS, then we want to work just off of the midline, exactly where we were before when we were doing the cross fiber stuff. But now we want to just be straight down into the fascia to release this, one layer at a time, minimum of 2 minutes. So you can either do it with your fingertips, you can do it with the heel of your hand, or you can do it with your elbow. But one thing's for certain, do not touch that posterior sacroiliac spine. It's way too sensitive. I like to go on the other side of the body as well, too, and with really good leverage. So if here's the PSIS, here's the coccyx, here's the midline. I'm going to be just lateral to the midline on the right side. And I'm going to go just straight down with my fingertips, using my body weight to do all the work for me. And if you don't have the fingers for this, then use the heel of your hand or use your elbow. So I'm going in really slow because I know this is kind of a sensitive area. Pressure okay?
Yep.
So it's about 3 pounds. You want to try and hold this for as long as you can. So you're patient, you're not rude. Don't go barging in. And you should start to feel this release within a few seconds. It just kind of comes like in waves. Are you feeling anything?
No, it's not uncomfortable. It's pressure.
Are you feeling anything let go or relax?
There, that's on the left.
Did you? You said what? Could you repeat that?
It felt on the left that it gave away a little. Mm-hmm.
What a coincidence. So I'm up to about, well, let me ask you, are you aware that I've tripled my pressure from when I started?
No. Feels like a lot less than when you were doing that last one.
Really? See how white my fingers are turning?
Mm-hmm.
Did you feel this? It just happened just now?
No.
Okay. It's all right. It's a unique feel, isn't it? Is there any way you could describe this to people what this feels like?
Kind of like an elephant standing on my back. It's hard to not want to fight it.